adolescence really is a high risk age of time here. The majority of graduating seniors, around 75%, report lifetime use of alcohol, nicotine, or other drugs, and usually that other drug is going to be marijuana. However, the majority of those individuals who report that lifetime experimentation, they fall within minimal risk or mild risk. It's that old, like, kind of rite of passage. We're going into this parenting thing as I expect my kid to experiment. I hope he or she does not, but wouldn't be surprised if they do. I think that's kind of how most parents view this. And so when we're interviewing and we're screening these young people, that's what we're dealing with, is the old school rite of passage. One thing I always have a conversation with parents nowadays, though, is that rite of passage is a lot different. I'm in my 50s. What I had experimentation with in the 80s is nothing like what young people have the opportunity to experiment with today in the 2020s. Purity, access, and perception of harm, completely different. But that's a whole nother training. Substance use disorders, the reason why we really want to get the youth screened is because the majority of them, 9 out of 10 adults, picked up their substance use disorder in their developmental and adolescent years. It's a pediatric onset disease. All right. So, and then brief intervention, it works. All the data, recent studies, years ago studies, all points to that. A brief intervention allows for a little bit of contemplation, a little bit of increase in perception of harm regarding somebody's behaviors. And what we've seen with various studies, if you're like a research geek like me, I put the link in there. You will be receiving a PDF version of all these slides so that you can click on them, refer to them later, and all of the resources. It's an interesting. So it just increases their motivation to change, readiness to change, all of these things that this research shows. So BI, brief intervention, absolutely works. And we have something, that we don't talk about much anymore, but, abstinence. With the rite of passage, parents often are like, well, yeah, abstinence is great, but kind of, I get it. And a lot of, most kids experiment. Research, right? And this research is going back. This isn't something that's new. We've known about this for a long time. But as an individual matures between the ages of 13 and roughly 25, I know it says 21 here, but the brain develops all the way for males at least to 25. The likelihood of lifetime substance abuse and dependence drops 4 to 5% for every year of abstinence, or that we delay initiation of experimentation. So if somebody's 11 or 12 and they start experimenting with alcohol, marijuana, for every year they're experimenting, they increase a 4 or 5% likelihood that they're going to have an SUD in their adult years. And inversely, if they maintain abstinence, if they avoid that experimentation, right, then they reduce it 4 to 5% for every year. So long story short, if you make it to 21 without experimentation, you have about a half, you've reduced almost 50% likelihood that you'll have an SUD in your adult years. All right. So how does SBIRT interfere? Work with that. Well, if you screen somebody and they're not using, then you give them positive pro-social recognition. Great job. That's so awesome. That's really great. And more people choose abstinence than not. So you're like doing everything that you're supposed to. All the research shows that if you wait till you're 21, you'll have less likelihood of acquiring an addiction or a substance use disorder, and have that conversation. If somebody is experimenting and using or have problematic use, then that conversation can kind of use this data as well. All right. SBIRT for adolescents or youth, there are challenges. All right. They're often hesitant to report use. And then on the other hand, some youth are like, they wear it with pride. It's like a war, medal. Yeah, I've smoked pot. Yeah, I've drank. I drink all the time. Yeah, I've tried this. every youth is going to be different, so it can be challenging in various ways. But unfortunately, we don't always get the full depth of use. All right, so they are often hesitant to report substance use. Trust takes time to build, and that's why I really like the self-report form where they fill it out themselves. They don't have to trust a piece of paper, right? They're just going into it, and they might be more willing to answer those questions. And I talked about that perception of harm, right? Access, purity, perceived level of harm. This is what we're talking about. Substance use abuse is often normalized amongst adolescent age populations. When I was growing up, we had a high perceived level of harm about it, but the normalization of doing it was there. It's just that at least my peer group and some of us, we kept it to a minimum where we were like, oh, okay, yeah, there's this harm, but it is normal to do this. When you view it as normal and you have a low perceived level of harm, frequency increases. And then you have fear of impeding opportunities, such as college employment, parental involvement, the judicial system. If they tell you about what they're doing, this is what they're going to worry about. Oh, you're going to, narc out, and tell my parents and everything. And that's where the confidentiality disclosure comes into effect, right? And we'll talk about that a little later. So there are challenges with youth. If you are having conversations with students, youth about their use, well, I'd like to hear from you. What seems to be working? So if you can maybe put in the chat, what seems to be working for you regarding like getting young people to kind of talk about their use, what they're doing, and I can just kind of read them off here as we go, and I think everybody else can see them as well. So if you don't mind, just being curious about why, how they use without judgment. Yep. But definitely have a trusting relationship before. Yeah, absolutely. That trust is so important. Keeping an open and safe space. Yep. I mean, and many of us have like this is a safe zone sign, right? No judgment approach. Absolutely. Yeah, as soon as we start judging, yeah, or even the tone. Yeah. Oh, right. We've got 15 people in here. I hope there's more than 3 answers. Go ahead and type some stuff that works for you in their chat, because I'd love to hear. We're all on the same page. We're all doing the same job here in some shape or form. And I'm constantly learning as well. No, it looks like that's about it. That's okay. All right. So trust and person-centered to discuss openly many difficult topics that teens. Thank you. That's a good one, Noreen. Appreciate that. Person-centered. Right? I guess, it's kind of like me, what they're dealing with. Yes, you can kind of like use the scale that some SBIRT tools use as far as like, well, for somebody who gets your score, this is what may happen to you. But I like the fact that it's person-centered. It's to them. Just listening to what they do with their friends. Yeah. That's really great. And, not necessarily who their friends are, but what kind of friends they have, right? I never ask for names of friends or anything like that when I'm seeing kids. I just, I'm curious about their peer group. So what kind of person do you like hanging out? Yeah, that's good stuff. All right. So, the reason why SBIRT is so encouraged for youth is, again, it works. But when you have somebody like the American Academy of Pediatrics backing it and recommending it, and SAMHSA and various other people, we got to roll with it. They're the experts. We are experts as well, but I mean, they're kind of our guiding body, right? So I see some other comments coming in here. Open conversation about substance use and family can be opening to, having the conversation about family. Yeah. Mm-hmm. And validate their feelings. Absolutely. And their attempt to cope in appropriate situation. I like that. I like that a lot. Yeah. I think back to my adolescent years and my teen years, and many of you, we had it easy breezy lemon squeezy in the 80s. I mean, we really, we didn't have the internet, we didn't have all of the the kind of constant bombardment of stressful input from our environment. And today, young people are really getting, a lot more information, which can be, difficult to cope with. So I think that's great. Yeah, good stuff. Thank you for that. Allows for self-reflection. As SBIRT, it allows that person to kind of answer these questions, get a little feedback, and then be like, oh, hey, light bulb moment. Maybe this person has a point. Maybe I just identified it for myself. Maybe this person doesn't even need to tell me this. I just recognized it by answering this question. But it does give them the power to imagine and explore some possible alternatives to what they're currently doing. And if they are already doing what they're supposed to, or say supposed to, what they're doing for fun and health and wellness, then it provides them for affirmation, positive pro-social recognition from hopefully a role model or an adult like us. And then, of course, if needed, it provides guidance, resources, if a change is needed, and it reinforces our prevention messaging. We're all preventionists, right? We're just trying to prevent the onset of problematic behavior in future years. So there's really kind of three areas to SBIRT, and we're going to kind of take a look at it as far as on a continuum. We have primary prevention, where this is the behaviors where primary prevention works. Some behaviors may require brief intervention, and then some behaviors are going to need to refer to treatment. And this is kind of what we look at as far as a 21+ month, right? So this is somebody who's like 21 and older, college age young people. A lot of times, their last junior, senior year, maybe graduate program. And a lot of individuals who are 21 or older live in this green, where prevention is really just the messaging. And yet there's prevention for adults, right? Like, responsible drinking, responsible use, understanding blood alcohol content, DUI, all that stuff, right? So we have abstinence, we have experimental use, and we have social use. Social use is quite normal for 21 and older, for alcohol, that is. And for many individuals, they use it safely, responsibly, without any negative consequences, right? And then you have substance use disorder, which is this like little kind of portion, right, of the adult population. And what we're looking at is that's where we want to keep individuals out of. That's where we're going to refer individuals to. For adult populations, green is great, good job. I see that you're drinking responsibly, you're using marijuana responsibly when it becomes legal, and just kind of encourage that continued behavior, right? So SBIRT is really designed for this area. This yellow, this area of binge use of a substance, abuse of a substance. This is where brief intervention, motivational interviewing, this is where that's going to help prevent or reduce the likelihood that that person ends up in the substance use disorder. All right. That's what an adult looks like. So a little bit different for young people. This is really where prevention goes for young people. Abstinence, right? And then dipping the toes into that experimental use. Right? And by say dipping the toes, that's like, yeah, I tried alcohol. Yeah, I tried weed. Really, I don't know what to think of it. Maybe I'll do it again in the future. Maybe I won't. Oh, it was completely not for me. That's what green or positive pro-social recognition from us, reinforcement of continued behavior goes, right? Well, great. I'm really happy to hear that you were honest with me, that you're doing the right thing. Great. Super. Keep it up, right? The red is going to be a lot larger. So this is where we want to keep the young people out of. We really don't want them socially using substances. That's that old rite of passage thing, right? Oh, well, they're going to go party, they're going to drink, they're going to smoke some weed. No, we need to change that. We need to understand that it's not the same. The worst thing I had to worry about social using was like 3.5% low grade, what was called swag weed that, 5 people smoked a joint, laughed for 15 minutes, then ended up with a wicked headache because it was horrible, or Budweiser. That was about what I had to say no to in the 80s. Now, today's marijuana is very super potent. They have access to all kinds of pills and analog drugs and club drugs. Purity is higher than ever. So we really, really want to reassess, is social use still a rite of passage when the playing field has changed, the substance has changed, and so that's why this red is so large. All right. And so where we really want to focus our brief intervention on is this experimental use and social use to prevent them moving into that red. So I hope this kind of explains and visualizes for you visual learners how SBIRT differs from youth, why it's so challenging compared to adult. And this is challenging. For those of us who work with youth, you all know this is challenging. All right, so somebody said, let me see here, go back in somebody had something that I feel open, just listening to what they do, discuss opening. I thought I saw somebody say something about meeting them where they're at, but maybe I just read into it. Meet them where they're at, right? Understand what stage of change they're at when we're doing SBIRT. I don't need to get into this because everybody's probably familiar with this. Pre-contemplation, contemplation is really where a lot of young people are going to do. That's where they're going to be. They don't really see a problem with their behaviors. And they're like, YOLO, you only live once. I'm going to drink when I go to a party. I'm going to smoke a little weed. I don't see a problem with it. Our goal with SBIRT is to raise awareness, raise their perceived level of harm about it, so that pre-contemplation, they move from pre-contemplation into contemplation and be like, oh, you know what? Yeah, maybe I'm not going to get drunk tonight. Maybe I'm just going to have, maybe I'll just walk around with the same solo cup all night and really not drink it. That's an improvement, right? Ideally, yes, we would love for them not to walk around with a solo cup and not drink much of it. But so that's kind of SBIRT. We're trying to meet them where they're at and trying to move them to the next level, stage of change. This is the Bucks County Clinical Pathway. This is awesome. This is a great tool. And you all will receive copies of this. And it's really just focused on the CRAFFT. All right. So if the person, we'll go over this, we'll break this down into depth. But if there's no risk, then positive reinforcement. Great job. Keep it up. Great. Anything else bothering you? Have that conversation regarding other things, because there might be a mental health concern there, right? It's not all about ATOD. However, mental health and ATOD go hand in hand, and we practice universal precaution for those individuals who are using substances at problematic rates. Universal precaution says there's more than likely an underlying mental health condition, right? That's probably diagnosable. Let's face it, right? Drugs work in the short term for many different mental health diagnoses. So no risk. Check in with them. Periodic screening in the future. If you meet with them like twice a year or once a year, do the screening again. This isn't a one and done. This is a repetitive thing, and that's why the self-report is so nice. You can keep it on file in their file and compare, right? Low risk. If somebody scores low risk, who's an adolescent, you do some brief intervention, right? A little motivational interview and frames. We'll talk about that, what frames the acronym stands for. And provide information to increase their perceived level of harm to move them from pre-contemplation to contemplation. Talk about the risks. And if they're a medium risk, that's where we're going to really kind of do the same thing as low risk, but then we're also going to engage in more of a collaborative conversation and help them come up with some possibly alternatives that they may be able to use. And we are going to want to refer that panelist information for consideration of the specialty, program for that age group, that youth. TAY, for those of you who don't know, that stands for transition aged youth, 16 to 25. Really, it's 14 to 20. I mean, it's kind of that that developmental year there. And then follow up at next appointment. If they score high on the SBIRT screening form, which we'll get to, then absolutely refer out. All right. You're going to want to get them an assessment. And that's going to be at either Aldi, St. Luke's, the council here, they can do those both in telehealth and in person. The referral is really important. What we see, unfortunately, a lot of our people are, and this isn't just like here. This is everywhere. People do the screening, but they don't refer. And I think that one of the main reasons is because people don't necessarily know all the resources where they can refer to. And youth, it's very limited. We've seen a decline, not an increase in places where you can refer young people to, which is really unfortunate. I mean, they are our future. They should be our priority, right? We should have like adolescent youth centers like everywhere, and we don't, unfortunately. You have to know where to send for an assessment, where to refer. And we really, really have to do that part. I can't stress it enough. So let's look at this, right? Just real quick review of that frame, because you might not have been able to see it real well. I know it's small. No risk, positively reinforce, rescreen periodically. Low risk, use the links provided to utilize the appropriate information based on the individual screening. That's going to be, like some of the information at SAMHSA and Bucks County Drug and Alcohol Commission, and follow up with periodic screenings, right? Engage them in a little MI and find out, their motivation for use. If you're trained in cognitive behavioral therapy, do a little cognition exploration. Keep it quick and short. Offer praise and encouragement for all of the things that they're doing right. And then if the medium risk, this is where, you're going to want to, use both motivational interviewing and the frames process, have a collaborative conversation, and you're going to want to refer to, again, one of the three, us, the council, St. Luke's, Children Family Focus, and the KS Multi-System Systemic Therapy Incorporated. And those are all active links. If you're not familiar with these places, when you get the PDFs, you can just click on them. You're also going to get the clinical pathway form as well, right? High risk, absolutely, refer out as quickly as you can. And you're going to want to collaborate with the provider, right? Get the releases and so you can have the conversations with them. Council, St. Luke's, Aldi are really going to be the three. What is brief intervention? Really, we want to keep it simple. There's an algorithm to it, which is 3 to 5 minutes, can be up to 15 minutes, but really brief intervention is typically going to be in that like 5-minute to 10-minute window there. We'll provide education about current use, potential risk of current use, match the individual stage of change, or you don't want to push them, you don't want to tell them what to do. As somebody said, you want to validate their feelings, you want to have an open conversation, you want to listen, and when you listen, you got to hear, right? And build that trust, as people have said, really approach it as you're not telling them what to do, you're just helping promote health and wellness and providing them with a little education, a little knowledge which is power, for them to hopefully make healthier decisions in the future, right? Some desired outcomes of brief intervention are going to be increased awareness of potential problems. We're going to, the person's going to be more educated or knowledgeable on the topic. Many kids don't realize the potential harm of vaping, right? That one is like a huge one. That they don't know all of the ins and outs. So if you educate yourself more on vaping, you'll be able to kind of increase their perceived level of harm about that. You're going to reduce the potential risk of harm. And so these are some of the goals, desired outcomes of BI. And if they want to set goals, we got to set realistic ones, right? Ones that are attainable. If somebody's smoking pot every day, quitting immediately in total cessation, it's not realistic. That's not going to happen with a 16-year-old, right? So we've got to set realistic goals that allow for them to experience success, right? Reduction in use, harm reduction, I guess you can say. I'm not a huge fan of that term, but I get it. Ideally, we would like for them not to use substances, right? So to get there, how do we get there? By setting realistic goals. And we'll do that with developing a plan of action and help support ongoing action. Let them know. I know some of the SAP who are on here have had interactions with over the years, and some of them are just like, I see them interacting with the kids, and I'm always like, oh my god, it's so great. Like anytime you need them, just come by, and the kids interact with them, and they're like, they refer to them as Mrs. or Mister, and it seems like they've got this like really good relationship that helps with that ongoing action and those attainable goals that they have. So that trust relationship is so important. Frames. What does the acronym mean? It means feedback. It means responsibility, advice, menu, empathy, self-efficacy. I'm not going to spend a lot of time on this because this is like, for many of people, this is, or you already know. But the feedback is just going to be focused on how that may impact their current and future wellness. Responsibility should be on them. It's your responsibility, man. I'm not going to tell you what to do. I'm just here to be helpful if that is what you want. I'm going to give you a little bit of information, a little bit of knowledge, because knowledge is power, to help better, increase the likelihood that you remain healthy and well. Advice based on concerns, not opinions, right? We don't want to talk about weed as marijuana as the devil's weed, right? Just look at the concern, specific concerns, and give them a menu of like what they would be comfortable changing. On a scale of 1 to 10, use a Likert scale, right? The readiness to change rule, which we'll talk about. On a scale of 1 to 10, how willing, with 10 being very willing and 0 being not willing at all, how willing are you to change your current behavior? And then give them a menu. And we always want to be empathetic. It is not easy being an adolescent. Never has been, but it's never been harder in this current generation. They've got a lot of things they have to swallow and process and out there today. And remind them that self-efficacy and their own ability to change is within their grasp. All right. Great feedback. Again, we're not going to go deep dive into this. You're going to get the slides. You can look at this. I think everybody knows this. But it's just really kind of just taking the information from the screening form and transferring that the risky behavior into identified concerns, right, from the screening. You can discuss personal risks associated with current use, provide them with general information, link the individual's presenting complaint to their substance use. If they're saying, it just seems, things are hopeless and helpless. And you go, okay, well, do you think maybe how does your substance use have anything to do with that? Do you feel like it might, impact how you feel? That kind of thing, right? Ask them, don't tell them. Responsibility, it's on them. Ask for permission, right? I always ask for permission. I noticed you answered, on the screening form, number 8. Would it be okay if we talk about that? And, so ask for permission to talk about it, or just even say, I'd like to talk about it. Would you be willing? It's all that language, right? It frames language. Advice. Again, ask for permission. There's one thing that does concern me. The part about, driving in the car with, your friends who may have been drinking. Would it be okay if I talk to you about my concerns about that? Right? Ask for permission. And then when they say, okay, you can just simply say, this may not be helpful to you, but, what we see is this, and these are some of the concerns. And all right. So it's all about how, we frame our conversations, and advice, put it in a way that you're not telling them, put it in a way that is going to help them move from pre-contemplation to contemplation through self-exploration, maybe that light bulb moment. I wonder if your alcohol or cannabis use might be interfering, blah, 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 right? Again, identify the concerns, the specific concerns. I'm concerned that you feel, or I'm concerned, right? That's the intro. You can also give them an out, just a thought, but this might make it easier for you. Would you be willing to kind of explore this? So it's all about the language and how we use it, right? And when we give advice. And that menu of options, again, right? Like that kind of harm reduction thing, the cutting down on use, reducing harm associated with use. Do they want to quit all use? I've had kids who are like, man, I am so done with this. I can't stop, though. All of my friends do it. I want to stop, but I can't, right? Boom. That's where, you link them up with resources. Getting help, right? Absolutely nothing. Sometimes people don't want to do anything about it. There's nothing you can do about it. You're not going to change them. You got to meet them where they're at. Yes, you can encourage, you can provide information, and we can, of course, always have consequences associated with continued use, which I think is good, right? Kept a lot of us out of trouble. Consequences work, but with SBIRT, it's not consequence-based. That's going to be more school-based, family-based. And of course, so many people put in the chat what works for them: empathy, right? You can't work in this field if you don't have the ability to understand and share the feelings of the very person who you're trying to assist or help or treat, however you want to say it, right? We always want to have a warm, respectful, caring tone, let the conversation unfold rather than us directing it. I mean, we redirect it, but we do it in a way that it's not obvious, right? And listen attentively, listen and hear. I always say, listen, you can listen, but not everybody hears, right? Good music, we can listen to good music, but you got to really hear it to appreciate it. And avoid authoritative expert tone. We don't want to ever come across as an expert or authoritarian. Even in our field, sometimes we interact with people and we're like, wow, they're a know-it-all. Don't be that person, right? We all have, every last one of us is constantly learning. Many people are referred to as experts, and that's cool because, you hold a lot of knowledge, but experts should always be continuing. So self-efficacy, what does that mean? And that's the last, S of FRAMES acronym. Your ability to achieve a goal or complete a task, what positive changes they've made before, really turn it back on them. Like, hey man, sounds like you went like a month without smoking weed last year, and that's awesome. So I mean, you could totally do that again, right? What do you think? Do you think that's something that you could do? Yeah, I guess so. So really kind of feed on them, on their self-advocacy, remind them of previous successes, no matter how small or how large. And if you can draw parallels of current behaviors to their substance use, do so, right? And of course, if you have time, doesn't always fit in there, address the myths, oh, it's just weed. And I just saw a recent study, came out literally last month, up to 25% of all age groups who use marijuana meet the criteria for a substance use disorder. That's mind-numbing. That is mind-numbing. So, there's this myth that weed is harmless. It's, it's non-addictive. It's, less harmful than alcohol. But nobody's talking about access, purity, and perception of harm, and how that's totally twisting it, and how the plant has been, hybridized to, anyway, that's a whole nother trend. So address the myths, right? Motivational interviewing along with frames, it's essentially motivational interview, right? So, we just want to collaborate. We want to have goal-oriented style. We want to address ambivalence. We want to, build up their confidence when it's low, and they doubt their ability to change. We want, we want them to identify the importance of why they might want to make a change. All right. So main purpose, key elements required for change is to have that person identify the importance of the change that they're talking about. They've got to have the ability or the access or the confidence for them to work towards it. And they really do need the desire to do so. And that's going to be through effective motivational interviewing and effective frames process, right? We're going to help guide the conversation to where they discover their desire. We're not going to be able to tell them their desire. So, building motivational interviewing, there's four principles, SBIRT, change talk, ORS, and the principles. So it's kind of like this kind of overlapping use of various tools to use MI. But the three key elements or the SBIRT for every conversation that takes place, collaboration between you and the client or the individual, the young person, you're going to evoke and draw out the client's ideas about change, and you're going to emphasize the client's autonomy or their ability to be successful for themselves, not what somebody else did, but what they're capable of doing. And we always, as the chat said, compassion, acceptance, partnership, right? We want to avoid resist. We want to follow rule, resist the writing reflex. Don't tell people what to do. Understand the client's motivation. Listen to your client. Empower the client. Basic communication skills. Open-ended questions. Tell me more about this. Is it okay? Affirmations. I appreciate you talking about it, so that they want to talk more about it. And then reflective listening, right? I'm talking about that hearing. It sounds like you may be, and using that, and then summarizing. All right, so we talk about, how you felt about this, and I really do appreciate you, sharing that with me. And from our conversation, it sounds like you're willing to give this a try. Did I get that right? So kind of take all of those things together and summarize them. And that's going to really kind of be the capstone of SBIRT, right? And you guys can review this later. We're not going to spend a lot of time, but we'll just look at what that summarizing looks like. If you skip down to the bottom, thanks for sharing and being honest, right? It sounds like your friends really mean a lot to you, since you are willing to potentially jeopardize your own health in order to hang out. But do you think there's a way you could get them to consider quitting or reducing the amount that they vape, do whatever? So there's this whole process, right, which makes SBIRT really, really easy. I'm a huge fan of the Readiness to Change ruler. You'll receive this cutout. It's like a paper one you can have on your desk. We also have like these rulers that we use, and we just have the person simply point to where their readiness level is, on a scale of 0 to 10, with 10 being very ready and 0 being not at all. Where you, what changes are, where are you ready? How ready are you to change? And if they point to a 4 or a 2, be like, okay, great. Don't be like, oh, you're only a 2. Why are you only a 2? Be like, great, you're a 2. Super. Well, can I ask you something? How come you're not a 1? And by them identifying why they're not a 1, they may have just, right, like identified, what did we call it before here? Empowerment or self-efficacy, right, for that individual to now recognize why they're not a 1, and maybe next time they'll be a 3 or a 4, right? And if after they share that, then you can ask them, well, what would it take, do you think, to get you up to, a 4 or 5? And so that's really kind of like the key with the readiness ruler. You can also use this to ask questions like, how important is it that you make this change? Not that you're ready, but how important, how confident. And these other questions can help identify what they might need from day to day, right? So if they're, how important is it? Yeah, wow, it sounds like it's important, but it sounds like, they may be an 8 on that, but their confidence is a 3. So, what do we need to do? We need to have a conversation about what are they missing that can build their confidence. We want to avoid misguided motivation. It's their motivation, not ours. What we think should motivate them will not motivate them, but maybe we can help them figure out. Um, that's motivational interview. We're going to help. We're going to help them. All right. So now we're into screening tools. Any questions so far? Any comments? Go ahead, put them in there. Anything that I missed? Anything that you want more information on? Let's see if anybody types anything in there. Okay, we'll move on. Common screening tools. CRAFFT, cut it, which is the cannabis use disorder identification test. Revised is the R. All right, and these are the two that you'll probably use the most if you're working with youth, because they really are designed for youth. Well, the cut it R is for anybody, but it's worded in such a way that it can be used for youth. I would only use the cut it R if needed. So you first do the CRAFFT, and then if there's cannabis use there, and that's like what you're meeting that person with, you can use the cut it R to get a little more information as far as what kind of depth are they using their marijuana at. All right. But there's S2BEI, there's the DAS-10, there's the audit, there's the CAGE, there's the RAPS-4, there's the SSI. There's so many different screening tools, but for youth, really recommend the CRAFFT. This is our go-to. This is what all the research shows is most beneficial for. And we'll take a look at real quick to cut it, right? This is great. I would like to see it a 12-month window. The 6-month is a little tight for adolescents. Sometimes adolescents, they can't remember what they did last month. And, if they think, 4 months ago was 8 months ago, then you're going to miss that data set. Whereas a year is a little more for them, easier for them to kind of wrap their head around. Well, this time last year, I was in 8th grade or 10th grade. Oh, yeah, I totally smoked weed over the summer. Whereas if they have to think 6 months, they're trying to determine, was that summer? Was that this? So that's my only complaint on the cut it R is the 6-month window rather than a 12. But as you can see, there's no real questions that kind of normalize its use. It's just asking straightforward questions. When you're grading it, hazardous cannabis use is used. Probably consider a different terminology, but possible cannabis use disorder too. This is not diagnosis. The screening tools do not identify a diagnosis. We're not diagnosing. The SBIRT does not provide you with a diagnosis. We have to send them to assessment to get them diagnosed, right? Or to see what level of care they would need. Maybe it means getting a diagnosis, but by no means are we diagnosing anybody. So I don't typically like to see the word diagnose in screening forms, but other than that, cut it, the R is great. My problem with the CAGE, a lot of people use it for adolescents. It works. I'm just being hyper vigilant here. And it says, try to cut down or change your pattern of drinking or drug use. It may normalize that, there's a healthy pattern or not. This is fine for adults. I'm cautious about it with youth because of the normalization tone of that question. And then even, words like eye opener, again, normalizing, use of a substance to get the day going. But you drink coffee. Well, caffeine does nothing but block the adenosine receptor from being filled with the neurotransmitter that makes us want to go to sleep. That's all it does. It doesn't produce serotonin and dopamine and increase heart rate to unhealthy levels and, clog up the lungs. So the eye opener, I'm not a fan. So that's my problem with CAGE. Other than that, you can use it, right? I just think that the CRAFFT, the wording has really been well thought through. All right. And it is more streamlined. But I know some organizations still use the CAGE. And that's, if that's what your organization is doing, cool. I'm by no means an expert or authoritative voice on this. I'm just like you. I read, I do my research. I double research, I back it up, I have all my links, and I just kind of go with what's best practice at the time. So, all right, the audit C. Is it ideal for adolescents? No, nope, nope. And it's really the 3-item. You know, can it be used for young people? Yeah. Is this often used on college campuses? Yes. Would you want to use this in high school age? No, because just the questions themselves normalize, like, oh, you must be drinking. How often do you drink have a drink containing alcohol? Yeah, and when you do, how many standard drinks? You're assuming they know what a standard drink is, first of all. All right. And then how often do you have 6 or more drinks on one occasion? And if an adolescent, unfortunately, is drinking often, their rate of drinking is a lot higher than adult rate of use, because for various reasons. All right. So I don't like these questions. The scoring, you're gonna give a young person, if their score of 4 or more is considered positive, means that they're engaging in risky alcohol use. But under 3, no risk. Or what's called low risk drinking. You're not going to tell a young person that, right? So the scoring is flawed too. But when you really look at some of the questions on like the audit, how many drinks containing alcohol do you have on a typical day? Like I mentioned, underage drinkers ages 12 to 20 typically consume 4 to 5 drinks per drinking episode. That's nearly double the average of 2 to 3 drinks usually consumed by adults. And that's research. That's not my opinion. So again, this is flawed. We shouldn't use it for 21 and older, because 21 and under, because their drinking patterns are completely different. If you want to look at the full audit, you can, but we're not here to talk about that. I see some people typing in, like, language is so important. It is. We may not catch it, but they do. They pick up on this stuff. I've got an 11-year-old at home. He picks up on tone and the way I say things sometimes, and I'm like, wow. I never looked at it like that, and we say things and we read things that just make sense to us, but we forget we've got, a 30, 40, 50-year-old brain. For some of us, maybe 60 in here, I don't know. But language is important. So DAS 10, very helpful, right? If you do the CRAFFT, if you do the cut it R, the cannabis use, and the kid is like using drugs, can you throw the DAS at him? Sure. Absolutely. Have you used drugs other than, those required? Do you use more than one drug at a time? Are you always able to stop using? This is fine, right? And, have you ever experienced withdrawal? This works for young people. I don't have a problem with the DAS if they already present, but you wouldn't want to throw the DAS to just a kid who's coming in off, first time. And it's not appropriate. It's kind of like a follow-up tool. Again, not a diagnosis, just identifies suggestions of action and degree of problems related to their current substance use. All right. And so the DAS can work. The CRAFFT, this is why we're here, the CRAFFT. I know it's taken a while to get there, but I really wanted to be inclusive to everybody, because there are some individuals on here who may be new to the field. And I just want to make sure it's clear. So now we're here. Now we're going to talk about the CRAFFT, right? There's 2 times, as I mentioned earlier, interview and self-report. The interview, you're reading it. It's scripted. You're interacting with the person. First time you ever meeting this kid, you're going to read a script, right? I wouldn't recommend. The interview maybe can be the follow-up, right? Like if they report like, minimal use or no use, and then, 6 months later you check in with them, can you use the interview, because now you have like a trust relation. Maybe they popped in a couple times and had conversation. Sure. But for the first interaction, I absolutely recommend you use the questionnaire. All right. Because it's just so much more to the point, and it's very easy to follow. I know it looks like a lot of words. I know it's small on your screen. I'm going to break it down and enlarge it so you can see it. Just 2 things. If you print both out, be sure to give them the questionnaire to fill out. Don't give them the interview, because there's some verbiage on the bottom here in circle on the interview that might, cause some concern for the kiddos. 2 or more yes answers in Part B suggest a serious problem that needs further assessment. All right. So if you're using, the questionnaire, make sure you hand them the questionnaire and not hand them the interview by accident, because they do look very similar, as you can see here. All right. But I'm a huge fan of self-report. So let's break it down. The self-report, first 4 questions is where it's the majority of kids stay, right? So during the past 12 months, how many days did you drink more than a few sips of beer, wine, or any drink containing alcohol? Put 0 if none. Right? So that question on the pre-test, yeah, we're not looking for the kids, who've taken a few sips of beer or wine or drink containing alcohol. They might be the kid who's going to the kegger, who was walking around with the solo cup half filled with beer, and they're not drinking it, or maybe they might take a sip of it or whatnot. Cool, right? Ideally, would I love for my kid to be there? No, I'd rather be at a game or, a sport or, culture or hobby. Yes, but there's going to be times when this is on. So that's why it's not on. We don't want to beat somebody up because they're, doing the responsible thing. All right. Use any marijuana, cannabis, weed, oil, wax, hash by smoking, vaping, dabbing, or in edibles. I talked about like what it was like in our generations or previous generations. You could only smoke it. Were there pot brownies that you heard of once in a while? Yeah, but for the most part, it was smoking. Yeah, there's just so many different forms. And that's why it has it broken down for the kids. Very few kids actually smoke weed now. The most preferred version is vape, because it's so easily concealed. But the problem with that is that's the most potent form. Use anything else to get high, like illegal drugs, pills, and you notice how they put in there, which I like, because a lot of states, marijuana isn't illegal. It's now legal, whether it's for medicinal or for adult use, non-medical use, recreational, right? So I like the words in here. Somebody said, yeah. Somebody asked, are there copies of it? You're going to be getting the copies. At the end of the training, you'll get all of the handouts, everything you'll need. But if you, Gene, if you ever are in the Doylestown office and it's just easier for you to grab some, let me know when you're coming up. I'll print out 100 of them and leave them for you at the front desk or something. Use anything else to get high, like the illegal drugs, over-the-counter medications. And inhalation is still fringe behavior. Kids are still doing it. Using a vaping device containing nicotine and or flavors. Use any tobacco products. So this is specific to nicotine. That's why this is considered the CRAFFT 2.1+N. The plus N means nicotine. There is a version that does not ask about nicotine. There's probably 5 different versions of this CRAFFT. The ones I'm going to be sending you, please use this one. This is the most vetted one. This is the one that that I feel it covers the gamut most effectively, right? It's been updated every couple of years. This is the most recent one. I believe this was 2021 updated, and they changed the word like illegal drugs, because like give it another year, we've got legal weed here in PA, right? And then self-instruction. This is the self-report. All right. Read these instructions before continuing. If you put 0 in all the boxes above, answer question 5 below and then stop. And I'll get to that. That was actually a question on the pre-test. The R stands for regret, right? I wonder how many people marked true. And I totally would have marked true for that one. It actually stands for relax. But there's also another one. The question 5.1 is going to be car. And I'll get to that, why that's so important. If you put 1 or more in questions 1 to 3 above, answer all questions 5 to 10 below. If you put 1 in question 4 for nicotine only, answer all questions on back page. All right, so this is sweet. This is very easy to understand. All right, it says question 5, if you put 0. Question 5, have you ever ridden in a car driven by someone, including yourself, who was high or had been using alcohol or drugs? That's such an important question, right? They may be doing everything right, But if they're in the car with other people who are, impaired or using, they just put themselves into a whole nother world of potential harm. And so that's why I really like this CRAFFT, and it just thinks of everything. It like not only identifies like, their own use, but behaviors and other people's use and how it might impact them. So again, R stands for relax, not regret. All right. And if somebody's using something to relax, might be a problem, right? For those of us who might have a glass of wine with the wife on a Friday night, or maybe two glasses of wine, or maybe just the one glass that's like really big. Cool, right? Responsible alcohol use by adults who are not binge drinking. 4 or more drinks in one sitting for females, 5 or more drinks for men. But yeah, so I really, really like the way that this is phrased. And if you did answer, you use marijuana, use anything else more than a few sips, then you're going to continue with 5, 6, 7, 8, 9, 10. All right. And they ask really important questions, like the relax, like the alone. All right. If you're using alone to relax, all of a sudden, a whole different story than going to a party and having a beer and seeing that it kind of makes you feel a little bit more relaxed. If you're drinking alone, that's a whole nother story, right? Forget, it's a big warning sign. Family or friends ever tell you need to cut down or reduce? Have you ever gotten in trouble? So these are like real questions that really allow for some really meaningful, dialogue, a little motivational interviewing, and using that frames, right? And this is the part C for the nicotine on the back side of it, right? When you print these out, print front and back. Don't give them 2 pages because that just is overwhelming. The instructions say on the back. So adolescent brain, they're going to turn it over and look for it on the back. They're not going to look for page 2. So make sure when you print these out, it's front and back print. Have you ever tried to quit using but couldn't? Do you vape or use tobacco now because it is really hard to quit? Have you ever felt like you were addicted to vaping or tobacco? I have so many kids. So many kids are like, I know it's just vaping, but I can't quit. I wish I never started. It's so hard to not vape because everywhere I go, everybody's vaping. Anytime I use a bathroom, I walk in, somebody's vaping. So these are questions that they can relate to. They were very well thought out. So 1 or more yes answers in part C suggests a serious problem with nicotine that needs further assessment. Again, if you hand them the interview, make sure it's the self-report interview, because what don't you see at the bottom of this one? Same exact questions, just different end. We don't want to send a kid away freaking out. We want them to just walk away feeling like, they had a pretty good conversation with a pretty cool person who I can trust in the future, and they have my best intention in mind. And that describes all of you, right? You put that at the end there, all of a sudden that kid is walking out, be like, oh my God. So again, just really be sure. Make sure you don't hand them a grading interpretation score chart. That's for you only. Don't keep them together. Keep this somewhere completely different. You only need 1 copy of this, right? So don't give that to them either. And again, this is for 21 and under, right? Not 18 and under. So this can be used on college campuses. This can be used on technical learning institutes. This can be used in so many different settings. All right. Let's go ahead and take a 5-minute break. Let's just call it 10:15. We'll be back, and I don't think we're gonna go to full 11, but we'll see how it goes. But I think we probably could use a break. I was shooting for 10 o'clock, but I like talking. So let's be back here at 10:15. Go grab a cup of coffee. I would say smoke them if you got them, but that wouldn't be appropriate. And I hope we're non-smokers. We'll see you back here at 10:15. Thanks. All right. I think we all should be getting back here in the next minute or so. For those of you who are sitting around waiting for the 10:15 to click, any comments or questions so far, feel free to type them in there in the chat, and we can get going. I hope this hasn't been too elementary for some. Hope that everybody finds some of it, or at least parts of it, useful. Okay, I've got 10:15. We'll get back on it. All right. So looking at the clinical pathways, this is really just an ideal tool. When we're looking as far as what do we do, because in the past we used something else. It was a very simple. I think I might have taken the slide out. It was a very simple pathway. And I wish I didn't take that slide out, actually, because it showed how simple it was. It didn't break down all of the steps. So, Bucks County Drug and Alcohol Commission and Magellan, I believe they collaborated on this and put this together. And it's a great tool. I have no part in making this. This was put together for Bucks County, and just knowing, as I mentioned earlier, kind of like the real problem with the real problem with completing the SBIRT, or completing the CRAFFT, was we were seeing completions done, and this is everywhere. This is across the country. People do the screening, but then they lack. Well, what do I do? Where do I refer to? So that's why this tool is so important, because it gives you 3 hard ones for referral for substance use. It gives you information and resources for everything from mental health to SUD. So depending on the level, you know exactly where to go. Without this, it could be a little overwhelming, could be a little confusing. You might need to, ask your supervisor, be like, oh, hey, do you know this? It might delay that person from actually getting linked up. So if there's one piece of information, if there's 2 pieces of information that you're walking away here today, is the CRAFFT 2.1+N self-report and this. These are the 2 big pieces that we really encourage to walk away with. And I already broke down kind of the steps of this earlier, but I wanted to show it again and just remind everybody how good it is, and why this was designed for you, for all Bucks County clinicians and counselors in Bucks County. All right. So this is another great handout. This is the substance use resource page. All right. So it has some links on it. I'm going to be updating some of these, the QR code, the SBIRT overview, maybe some of the screening tools and additional videos. Those are on our website, and we're redoing our website, so stay tuned. The council's website will probably be redesigned sometime this year. I hope I'm not misspeaking on that, but I believe that's the goal. And we're going to be looking, with this form, level care assessment sites. So the 3, the Aldi, the St. Luke's, and councils. If you're unclear whether a level of care assessment is needed, a referral can be made to the Mobile Engagement Services, the MES, and it can be accessed through St. Luke's Penn Foundation as a community-based addiction intervention service for individuals and families. And you just simply call them, right? So if all else fails and you're not quite sure, give that number a call. All right. So you'll be getting this form as well. You probably find it fairly helpful. So I wanted to show you kind of like what this is a screening that was done. You notice that this is a condensed version here. Okay, so this looks a little bit different than the other version. It's the same questions, and we'll go on. This is let's see if this works here. This person scored a moderate risk. All right. So they answered it as they don't drink alcohol. They've used marijuana 12 times in the past year. All right. And that's why, again, I like the CRAFFT. I mentioned about cut it only being 6-month window. The CRAFFT is a 12-month window. And so was that like all in 1 or 2 weeks, or was that like once a month? So that's where that motivational interviewing, that's where that, frames and ors all comes into play. You can kind of get more information than just a numerical value. But he doesn't use anything else to get high. They don't use any tobacco or nicotine. So the reverse page isn't on here. And they've never driven in a car with somebody who's been high or used drugs. But they do use alcohol or drugs to relax and feel better. But they haven't done it while alone, right? And they've never forgotten things they've done. They've never had anybody tell them that they need to cut down. And have they ever gotten into trouble? So, looking at this, if you're not quite aware of where the score is and you don't have the conversation, you could look at this and be like, ooh, this is bad. But honestly, this is somebody who fits, unfortunately, the majority of people sometimes. All right. Occasional use and just looking at it numerically, right? Now comes time for the conversation. So we'll see if hopefully this works. Can somebody? So I see that you filled out I'm going to pause that. Can you guys hear that and see that? Somebody put in chat if you can hear and see it. You can both hear and see it. Perfect. All right. Because sometimes I have problems with this. Our alcohol and drug questionnaire. Thank you for doing that. Is it okay if we review that? And just put a disclaimer. This is the person on the left was one of our prevention specialists who worked with us last year. Great young guy. He volunteered. He's in his 20s, but he pretended to be a 17-year-old. So this is not a real client. This is, of course, a reenactment.
Yeah, I guess so.
All right. Just so you're aware, what we talk about in here is confidential. All right? I only tell your parents about what we say if you give permission, or if I have concerns, or if I become worried about a danger to you or someone else. Does that make sense?
Yeah.
All right. All right, great. So let's take a look. So I see here that you've marked that you sometimes use marijuana, and that you marked you have used marijuana to relax, feel better about yourself, or fit in. Do you mind telling me a little bit more about your marijuana? So this is where the asking the permission comes into play, right? Just kind of, that's why it's so nice to have the self-report. It really just kind of allows you to look at it, assess it right there on the spot. You're not going to like leave the room and come back in like a doctor or whatnot. It just allows you to review it right there in front of them. I use.
Well, I guess so. It's not a big deal. Sometimes, me and my friends will smoke when we're at a party, or really just kind of hanging out on the weekends together.
Okay, so you smoke a little with friends at parties or whenever you're hanging out on weekends. How long have you been doing
that? Probably for the last year or so.
Okay, great. All right, so I see here you marked 12 as the number of times this past year. Am I correct in assuming that's about once a month or so?
Yeah, maybe sometimes twice a month. I don't really see a big deal with it. I think it's safer than alcohol. My parents would also agree with that.
Okay. And so you may hear that sometimes. So that brings in now a whole nother layer of like where you want to go with this young person, right? So like parental expectations. Like we said, 75% of young people who are graduating high school have experimented with alcohol, nicotine, or other drugs in their lifetime, right? The 25%, what was the number one reason why they did not experiment? And it was parental expectations or perceptions. Their parents mean something, right? And if we have these expectations, if we have clear boundaries and when we also model the behavior, then it's that much easier. I'm curious, what do you like about marijuana?
Yeah, what do I like about it?
Yeah.
I don't know. It's just kind of fun to do with my friends. It let us relax after a long week at school. And my job at Starbucks has kind of been a little stressing me out. It's a pretty normal thing. Kind of like I said, when we're hanging out at parties or at a friend's house. It's not like we're getting drunk or doing hard drugs. I guess it just makes everything more funner.
Okay. All right. So it sounds like you like to relax and have fun when you're smoking with your friends, and you see it as not as bad as like harder drugs. So I'm curious. Are there any parts about it that you don't like?
Yeah, I guess I don't like feeling tired the next morning, having a sore throat, and it's I don't like the cost of it either. It's quite expensive.
Yeah. Okay. So I see that you marked here that you've never forgotten things when you've been using marijuana. And what that means, just so we're clear, is you don't remember things from the night before. And so that's accurate, correct?
Yeah, I always remember what we did, but sometimes I can't remember what we were talking about. But I also hear that's pretty common with marijuana.
Okay. And I see that you marked you've gotten in trouble. Can you tell me more about that?
Yeah, so my mom has found a couple of roaches one time and a bag of weed another time that I was saving for the next weekend. I ended up getting grounded each time, sometimes for really just a couple of weeks.
Okay. Um, all right. And have you talked to your mom about using marijuana?
Yes, my mom thinks it's a big deal. I mean, I get it. She's being my mom and everything, but my dad smokes, and I know he doesn't really think of it as a big deal. He uses it as medicine. My mom and dad sometimes get in fights about it.
Okay. So, again, right? Like, we just want to, is there medicinal benefit? That's not, I'm, I'm not professional enough to say whether there is or not. A lot of the research points to yes. However, it can be counterproductive for some diagnosis. That's a conversation that adults should really have between themselves and a medical provider. But as you can see, right, like the mixed expectations there. The dad doesn't think it's a big deal for his son. So, okay, so it sounds like you're expected not to use
Yeah.
marijuana. Sorry. And I noticed that you answered no riding in a car with someone who's been using alcohol or drugs like marijuana, and that you haven't driven a car either after you've been drinking or using drugs such as marijuana. Is that correct?
Yeah, that's what I marked.
Okay. Well, that's great. And I hope you continue to avoid those things. However, I do want to know, that I am concerned with your marijuana use. When teens use drugs, things can go wrong, like injuring yourself, even when you don't think you're impaired. Also, between the ages of 12 and 21, your brain is still developing and it's very sensitive to the effects of things like marijuana. That's why I recommend for people your age, simply wait until you're 21 to decide if that's something that you want to experiment with at that time when your brain is fully developed and you have what's called an adult brain. Um,
Okay.
Okay, great. So if you were to think about stopping your use of marijuana today, I have here just a little scale. On a scale of 0 being not at all ready and 10 being very ready to change, where would you be for stopping to use marijuana today?
Yeah, I don't know, maybe a 5.
Okay. Okay, I'm curious. Why didn't you pick a lower number, like a 1 or a 2?
Yeah, well, I guess I'm just tired of getting in trouble. And one of my friends who doesn't smoke is giving me kind of a hard time about it as well.
Okay. Well, what could you do to avoid getting in trouble? Have you ever tried not using marijuana or
Uh,
stopping altogether?
yeah, I guess there's been lots of times that I've hung out with friends who don't smoke, and not all my friends do it.
Okay. That's great to hear. Some people your age start with trying to stop marijuana for a period of time just to see what that feels like. Do you think you could do that?
Yeah, I could probably do that.
Okay, great. How long do you think you could go without using marijuana?
I don't know.
Do you think you could go 2 months without using marijuana?
Yeah, probably.
Okay. What things would make it easier for you not to use marijuana during those 2 months?
Yeah, I can probably just make up an excuse why I can't. Like maybe not being grounded again. I also can really just hang out with friends that don't smoke.
Yeah. Well, it sounds like you've thought this through. I think surrounding yourself with friends who don't use marijuana is a great idea. That way you don't feel pressured.
Yeah, I guess so.
Okay, so you've come up with some great reasons here that I've jotted down for you to stop using cannabis or marijuana, like having not enjoying the sore throat, feeling tired afterwards, getting in trouble, and you've also come up with a plan to avoid using marijuana in the near future, which I think is a solid plan. I think it's great that you're giving this a try. How about if I have you make an appointment for 2 months from now, and we can see how things are going at that point?
Yeah, okay.
Okay, great. I would like to give you just this little information about marijuana, and it just helps give you some information that you may not see on some of the sources where you're getting your current information on marijuana from. Great. If there's any questions, you can always reach out and call me at my office, and I'd be happy to talk.
Will do.
All right, great. So, of course, that was scripted. And it's not always going to be so like cut and dry, but really just kind of for time wise, that's really trying to cover all the bases that we talked about. And the reason why I really like reviewing it afterwards is because you can kind of sometimes get a little bit more information. Like if you noticed, nobody, do your family or friends ever tell you that you should cut down or your drinking or drug use? And he marked no. But through our kind of, collaborative conversation, motivational interviewing, we ended up discovering that, one of his friends does give him a hard time about it. So that's why, there's just kind of following the recommendations for SBIRT and the way it's implemented is so it can be beneficial. All right. So that's basically just, what it would look like in the perfect world, real kind of 5 to 10 minute window. And out of that 5 to 10 minutes, what we were able to successfully do is we were able to identify that person's own motivation or reasons for not using marijuana, right? They identified other social options for relaxing and having fun, which do not include using marijuana. And the young person has a follow-up appointment to check in or rescreen regarding, success or challenges. And then the young person left with a little bit of information that they may not have known beforehand, as well as something, a brochure type information. And the research is mixed on whether or not young people actually read things that are handed, but some might, right? We can all make someone's life healthier. So we want to continue to, help identify individuals who would benefit from change in current patterns of ATO use. We want to provide information, want to provide recognition when appropriate, convey the message of hope, promote self-advocacy, help them out, provide assistance when needed, and continue to provide community resources that they may find beneficial. And then, of course, if needed, a referral, right? Get them out. I talked about confidentiality, Act 53, right? If they refuse treatment, there is the option to where you can, between the ages of 12 and 17, the legal system can require a parent to, use this act to get their child to enter drug treatment. So I talked about confidentiality. Sometimes you're going to go outside of that depending on the scenario, and sometimes people might families might end up using Act 53. But really, SBIRT is, that might come after assessment. You complete the screening, you assess them as high risk, you refer to them, they sign releases. A lot of times with the parents, they refuse treatment or they don't engage, and that's where the Act 53 comes into play. All right, this isn't something you're going to throw out there, right? And, the first time you meet with the person. Another, just wanted to touch on this again, the substance use resource page. You will receive copies of all this. If you're ever just completely, confused and you're looking for, help for individuals, there's the SAMHSA National Helpline. And with that, let's go ahead and open up the questions. All right, so we finished a half hour early, which was awesome, because sometimes we can drag on these, and I just really wanted to be respectful of everybody's time. So any questions so far, and hold off on the post test until we have a little bit of discussion, comments, anything you found helpful or you're not clear on,